like to call to order Ramsey County Board of Commissioners. Roll call, please.
Chebin Singh,
Here.
McGuire,
Here.
McMurtry,
Here.
Miller,
Here.
Moran is excused, Zhang,
Here.
and Ortega.
Hi, could we stand for the Pledge of Allegiance? I pledge allegiance to the flag
of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Acknowledgement, Commissioner Miller.
Yes, thank you, Chair. Every county owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will, some were drawn to leave their distant homes in hopes of a better life, and some have lived on this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We are standing on the ancestral lands of the Dakota people. We want to acknowledge the Ojibwe, the Ho-Chunk, and the other nations of people who also called this place home. We pay respects to their elders, past and present. Please take a moment to consider the treaties made by the tribal nations that entitle non-Native people to live and work on traditional Native lands. Consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events.
Thank you. I'll entertain a motion on the agenda of October 21st, 2025.
So moved. Second.
Any discussion? Hearing none, roll call.
Miller,
Aye.
Moran is excused, Zhang,
Aye.
Chebin Singh,
Aye.
McGuire,
Aye.
McMurtry,
Aye.
and Ortega.
Aye. I'll entertain a motion on the minutes of October 14th, 2025.
So moved. Second.
Hearing no discussion, roll call.
Miller,
Aye.
Moran is excused, Zhang,
Aye.
Chebin Singh,
Aye.
McGuire,
Aye.
McMurtry,
Aye.
and Ortega.
Aye. We have a proclamation for Mao Ho Tao, retirement proclamation. Commissioner McGuire.
And if I would ask Mao to come here, and anyone else who's here with her, please join me at the podium or at the dais. Welcome. It is indeed my honor to be joined by Mao Hu Tao to acknowledge her retirement. Mao began her distinguished career 39 years ago in 1986 as a public health nurse in the Family Health Division of St. Paul Ramsey County Public Health, later serving on the International Health Team and ultimately becoming the Hmong Health Coordinator in the Community Engagement and Health Promotion Team within the Healthy Communities Division. Mao has been a trailblazer in public health, dedicating over 46 years to advancing health equity, developing culturally responsive care, and forging partnerships among public and private health organizations, social services, schools, and community leaders to eliminate health disparities in the Hmong community. I am excited to honor and celebrate Mao Hu Tao. We are grateful for her decades of service, her unwavering commitment to health equity, and her profound impact on the lives of countless individuals and families within our department, county, nationally, and abroad. Thank you for your exceptional work and experience. I will now read off the proclamation. Whereas Mao Hu Tao began her distinguished career 39 years ago in 1986 as a public health nurse in the Family Health Division of St. Paul, Ramsey County Public Health, later serving on the international health team and ultimately becoming the Hmong health coordinator in the community engagement and health promotion team within the Healthy Communities Division. And whereas Mao has been a trailblazer in public health, dedicating 46 years to advancing health equity, developing culturally responsive care, and forging partnerships among public and private health organizations, social services, schools, and community health leaders to eliminate health disparities in the Hmong community. And whereas she made history in 1982 as the first Hmong refugee to return to Bon Vinay refugee camp in Thailand, where she addressed 40,000 refugees on behalf of the United Nations of High Commissioner for Refugees, dispelling misinformation about Western health practices and encouraging resettlement to the United States. And whereas Mao contributed to the sudden infant death syndrome research at Pananakong refugee camp in 1990 and joined St. Paul Mayor Kelly's delegation in 2003 to Wat Tam Krabok refugee camp to prepare for the final wave of Hmong resettlement in Minnesota. And whereas Mao founded the Hmong Healthcare Professionals Coalition and the Hmong Resource Group at St. Paul Ramsey County Public Health, and pioneered culturally relevant health education through Hmong health talk shows on television and radio broadcast, and post 9/11 emergency community health outreach programming. And whereas Mao has served with distinction on the boards of the Women's Association of Hmong and Lao and minors in need of resettlements, championing programs for elders, domestic violence prevention, and scholarships for young Hmong women pursuing higher education. Oh my goodness. Now, therefore, be it proclaimed, Mao's legacy will continue to inspire future generations of public health professionals, community leaders, and advocates for justice and cultural understanding. And be it further proclaimed, the Ramsey County Board of Commissioners do hereby honor and celebrate the retirement of Mao Hu Tao, expressing deep gratitude for her decades of service, her unwavering commitment to health equity, and her profound impact on the lives of countless individuals and families. Congratulations, and thank you so much for all your work. We are indeed a much better community because of your contributions. Thank you so very much. Yes. Yeah. Why don't you go first? Do you want to use this? Okay, Amy, go first. Okay, and then we're going to let you speak.
Good morning. I'm Amy Karen, Public Health Director, and today we gather to celebrate the incredible legacy of Mao Hu Tao, a woman whose career has been a beacon of dedication, compassion, and transformative public health leadership right here in Ramsey County. Her work has always centered on one powerful mission: closing health disparities in the Hmong community. She didn't just serve, she built. Mao founded the Hmong Healthcare Professionals Coalition and the Hmong Resource Group at Ramsey County Public Health. She bolstered public health education through Hmong health talk shows on KTCI Channel 2 and monthly radio broadcasts across multiple stations, ensuring culturally responsive care, reaching countless corners of the community. I must say, her leadership has extended far beyond our office walls. I would like to introduce you the chair of Hmong Healthcare Professionals Coalition, Dr. Yang. Yang will tell us more about Ma's work within the community. The coalition is a partnership of Hmong public health experts based in St. Paul. Since its inception in 1995, it has grown to become a central health resource for Minnesota's Hmong community. Its members and volunteers conduct research, educate patients, develop best practices, and provide leadership to other health groups. Welcome, Dr. Yang. Over here.
Thank you. Thank you, everyone, for inviting the Hmong Healthcare Professionals Coalition to join you in this heartfelt celebration, and for giving us the chance to honor and recognize Mao for her truly extraordinary 4 decades of service, commitment, and love devoted to public health and the uplifting of the Hmong community. Standing here today, it's impossible for me not to feel overwhelmed by the legacy that Mao has built, one formed not only by her work, but the personal sacrifices, deep compassion, and unwavering vision she has offered to every one of us. To so many, Mao is the public health nurse who arrived at their doors during moments of crisis. Whenever there was a measles outbreak in the 1990s, the devastating poisoning epidemic, or the countless infectious disease emergencies that have threatened families over the years. In the darkest days, she was there, steadfast, knowledgeable, and above all, caring. During the COVID-19 pandemic, when uncertainty and fear swept through our community, Mao was there, again at the forefront, offering guidance, reassurance, and hope. But to us, Mao is much more than a nurse. She is the visionary founder and long-serving chair of the Hmong Healthcare Professionals Coalition. She is the guiding light who saw the dire need for a united front in healthcare, especially for the Hmong community, and answered that need by bringing people together, forging powerful alliances, and inspiring a spirit of collaboration that endured for decades. In a recent interview, Mao reflected on the challenges and triumphs of her early career. She spoke beautifully about how urgent necessity, the real, tangible need in the community, sparked a deep and lasting unity among her colleagues, and how working hand in hand with organizations like Ramsey County Public Health became the foundation of long-lasting partnerships that have saved lives and transformed our healthcare landscape. Mao's leadership and compassion have extended far beyond the coalition. She has played a pivotal role in the launching of other vital organizations, including WAL, as well as what the former speakers have already talked about. She is dedicated in supporting women and children facing domestic violence, providing not only safety, but hope and a pathway to healing. She has driven movements and empower Hmong women to step into leadership as change makers and leaders, into advocacy, encouraging them to raise their voices and claim their places as leaders and protectors. Her efforts have created ripples throughout the Hmong community, opening doors and inspiring generations to believe in their own ability to make differences. What is truly remarkable is that Mao has poured not only her time, but her heart and personal resources into these causes. She has given selflessly, always putting the needs of others first and never losing sight of the greater goal, a healthier, stronger, more united community. Her legacy is not measured only by the programs and policies, but by the lives that she has touched, in the hope that she has sparked, and an enduring spirit of service she leaves behind. On behalf of the board of the Hmong Healthcare Professionals Coalition, past board members, and the hundreds of coalition members whose lives and careers have been shaped by Mao's leadership, I want to express our deepest gratitude to this proclamation recognizing her accomplishments. We want Mao to know how much we cherish her, how fiercely we admire her, and how determined we are to continue pouring ourselves into this work in honor of her passion, her courage, and her spirit. Even as Mao retires from her role, we are thrilled to know and relieved to know that she will continue to serve and guide us. Her wisdom and compassion will remain a source of strength and inspiration. Thank you, Mao, for everything you have given, for the barriers you have broken, and for the generations you have uplifted. I was merely a medical student when she first interviewed me. Mao and I met at our first interview on Gekongxia, but she didn't remember that. But she is one of those inspirations that lifted many of us who have gone into healthcare to serve. And so, Mao, your legacy lives on in all of us, and we promise to carry your torch forward. Thank you. Wow. Thank you so much. I promised myself not to be emotional, but I may not be able to keep that promise. But I'm truly honored to be standing in front of all of you this morning, celebrating a share progress. I didn't get here by myself. I got here because of all of these. I think we have some staff over there and then thousands of people who were helping me throughout my career. So for that, I'm grateful. I want to extend my deepest gratitude to Chair Ortega, our Board of Commissioners, and our county manager for your continued support and providing vital services to benefit our Ramsey County residents. To my St. Paul Ramsey County Public Health, I thank you for hiring me, for giving me the opportunity to serve the refugee community, particularly in the Hmong community. I spent 39 years with St. Paul Ramsey County Public Health, and I could not have done this work without you. So again, I didn't get here by myself. I got here because I have people who understand the challenges of new refugees into the country. So I'm just grateful for the opportunity and your trust in me in getting community members together and work for. So the work is created by community members for community members, but I could have not done this without all of you, and especially Ramsey County Public Health, for your continuous support, no matter how difficult or how easy it was. I want to also thank my family, friends, and colleagues. Without you, I won't be here, because your encouragement and your support means the world to me, because sometimes we don't know what's going to happen. But without having strong leaders such as yourself, family members supporting you, reminding you that it's important to continue, to keep going, I won't be here. To the Hmong families, I thank you for your trust, for welcoming me into your home, to your hearts, sharing your stories. I learned a lot over the years. Even though I myself was a refugee, I still learned a lot from other refugees' families, and which speaks loudly about the lack of health and the challenges they face when getting healthcare in this country. To our community leaders, local health, public health, local health agencies, and especially the Hmong Healthcare Professionals Coalition. Again, I could not have done this work without all of you and the thousands who couldn't join us today. I'm grateful for your friendship, for your leadership. You may see me as your leader, but you are my leader. You give me so much energy, so much hope for the future, and so I'm grateful for that. I want to especially thank the thousands of volunteers who may be watching online or who may not be here today, but they know they've been a part of the coalition. And again, the coalition, we work a lot to address health disparities and to look at what are some of the gaps and how do we go about making life easier and healthier for our community. So I'm just going to say that, but again, I'm grateful to be here. Like I say, I won't be here without all of you. I know some of you are sitting over there. You might be back here. But for that, I'm just grateful, and I just want to thank you for giving me this opportunity. I'm accepting the commission not just for myself, but on behalf of each and every one of you and the thousands at home. So thank you very much for your time.
Okay, good morning, Chair Ortega, Commissioners, and County Manager Ling. I'm Deputy Director Gabrielle McNeil, and in recognition of Miles' retirement proclamation, St. Paul Ramsey County would like to first acknowledge and commend again all the staff and partners who have worked tirelessly alongside Mao to end health disparities and inequities in our most vulnerable populations and communities. Some of these individuals are standing with us, like she said, and we want to thank you all as well, Public Health does. Mao, thank you for your 39 years of unwavering service to Ramsey County Public Health. Your legacy will echo through every life you've touched. Your work has been recognized with numerous prestigious awards and accolades over these years, but your greatest achievement is the trust and hope, like you just said, that you've inspired in millions of lives. The proclamation acknowledged a lot of the highlights that we should really note. Another one was that Mao intentionally ensured a public health presence annually at the Hmong International Freedom Fest, one of the largest Hmong sports event in the nation for countless years. I want to highlight that. Mao, Ramsey County is better, stronger, and more compassionate because of you. I applaud you. I was a previous supervisor of Mao for my first 2 years at Ramsey County, and we will applaud you today for a remarkable career and a well-deserved earned retirement. Thank you for your service.
Thank you. Thank you, Mao. You are not just a trailblazer, you are a role model for all of us. So I want to thank you for all you've done for our community. Marshawn?
Thank you, Mr. Chair. I am bursting at the seams with joy just listening to all of the accomplishments that you have made in your role in public health, but also to our broader community, to the Twin Cities Metro here, and even internationally. You should be so proud. I think about many legacies of so many of our leaders, and also about, like a leader never does it alone. They always bring people along, and you are such a great example of that for our community. And as we celebrate you today, I want us to call for us as leaders, and even at the county across our organization, about what can we do with our power and our relationships in the community and really leverage that. So, Mao, thank you so much for leaning into and embracing your full heritage, and always thinking about the community, about what can I do in my role to help make the lives of the people in my community better. So thank you so much for that time and service. Your mark is going to be, your presence is going to be missed at the county, but I know that your work will always continue on into the community. Thank you.
Can we get some pictures?
And thank you, Mr. Chair. I should have had my colleague, Commissioner Zhang, present with me, but I've asked her to join our photo because we so appreciate your leadership in the Hmong community as well.
Jason is about in every other picture.
I know.
I think I'll take 3. I'll count down from 3. 3, 2, 1. Perfect. 3, 2, 1. Last one. 3, 2.
Who has? Who has the, what do I do with it? Who has the administrative?
I do.
All righty. Commissioner Miller, the administrative agenda.
Yes, thank you, Chair. I would like to move the following administrative items. Item number 4, revenue agreement with Monarch Healthcare Management for LLC.
I'd like to pull item number 4.
Okay.
Item number 5, grant agreement with the state of Minnesota for Minnesota Multipurpose Community Facility Grant Project, and I would like to pull that one.
Okay.
Item number 6, amendment to the agreement with Aliyah Innovations for implementation of Minnesota African American Family Preservation and Child Welfare Disproportionality Act. Item number 7, amendment to single source agreement with Youth Prize for Youth Services.
I'd like to pull number 7.
Okay. Do I hear a second?
Second.
Hearing no discussion, roll call.
Miller,
Aye.
Ran is excused. Zhang,
Aye.
Jevin Singh,
Aye.
McGuire,
Aye.
McMurtry,
Aye.
and Ortega.
Aye. Item number 4.
Yes.
Commissioner Singh?
I would love to have staff or folks who are representing this project come to maybe answer a little bit and describe this pilot project.
Good morning, Board Chair, Commissioners. I've got a few notes here, and I'm probably the best person to speak, but I wasn't exactly super prepared to speak, but I will do my best here, so just excuse any omissions, but feel free to ask questions. So this agreement is with Monarch Healthcare. It is a private company that runs 7 long-term care facilities in Ramsey County. The agreement mirrors very closely, almost identical, to another agreement that we've had in place for a number of years. And in fact, I think it's been over a decade that we've had an agreement like this in place with Regions Hospital. And this is where we have an eligibility specialist, formerly known as financial worker, assigned to a particular agency, and that will be their primary work for that agency. They are still county employees fully. They are not employed by the agency at all. We still direct their work. They prioritize the work from that agency. When they are done with that work, they move over to other work that we have within the organization. So we don't lose any processing power, if you will. We don't lose any work from that. We share the cost of that, and what I mean by that is there's no levy impact because they are paying for the portion of the salary that is not covered by random moments reimbursement. So the random moment time study, I know the board has heard a lot about that during the budget discussions, but that's approximately 50% will be covered through random moment reimbursement, and the other 50% would be covered by Monarch Healthcare. That's a broad overview. If there's questions, I'm happy to stand for questions.
Commissioner Singh?
Yeah, I was just curious. So we've had a similar type agreement with Regions Hospital before, so we have experience with this. I guess my question is, how did we come to learn that Monarch was interested in such an agreement and that selection process? Curious if we've ever had any other organizations who are interested in this kind of an agreement.
Yeah, thank you for that question, Commissioner. We became aware of that. They have similar agreements with Hennepin County, and they reached out. I previously worked for Hennepin County, and they referred, Hennepin County referred Monarch to me when they had asked, like, well, we're interested in other counties. And so a colleague at Hennepin County referred them to connect with me, and we explored this for a while, like how to set it up, and we set it up very similar. The contract that Hennepin County has is very similar to what we've set this up, but we really mirrored the language from our Regions contract because that's been established for years, so we didn't like mirror the Hennepin County contract. We really mirrored our Regions contract. But yeah, they reached out on behalf of their agency a number of months ago, and so this took some time, obviously, to develop the contract, make sure the language was clear with the county attorney's office and all of that, just so that we were covering all of our bases.
And can you explain what kind of individuals are served by Monarch and where within the county are they served?
So Monarch, the agency has 7 locations for their long-term care facilities in Ramsey County. They serve mostly elderly adults, and they would, so these are folks who are in long-term care facilities and by definition are there for an extended period of time. They're not usually in and out, but sometimes that does happen. And so they work directly with our eligibility specialists then to establish medical assistance for reimbursement for their facility stays.
And are there
where are they located? Are they in one particular area? Are they all in St. Paul or throughout Washington County?
Throughout the county, yeah. I have a list of their locations. I don't have it up right now, but I do have a list.
So it's throughout. And then I guess my last question is just, we know that there are other provider organizations who often reach out to us as commissioners and staff, you know, asking how they can help the clients they serve better get processed through the types of programs that we at the county administer. Is this project limited to just Regions and Monarch, or if there are other organizations who are interested or who are watching this, is this the kind of thing that they can request discussions of, or is it limited to just these organizations?
That's a great question. Thank you for asking that again. You asked that previously, and I omitted that answer. I apologize. So we're not limiting it, but we are considering this a pilot because it is a little bit different than our Regions contract. We're assigning 2 eligibility specialists because we did a workload evaluation to see what sort of support that they would need. Originally, it was going to be 1, but then after deeper discussions with the agency and looking at the work that they had across all 7 locations, we decided on 2. I think that, so we are going to be evaluating it along the way. We have one of our evaluators that's assigned to FAS to help us see how it's going along the way. But we've been open to conversations from other agencies. We have not been approached by other agencies to ask for similar. And I will share, there are other agencies that have similar contracts in other counties as well. And so that also have facilities here in Ramsey County. They have not approached us to set up similar contracts here.
I have one last question. Is there any reason to think that there would be any impacts at all, positive or negative, on other individuals who are being processed by the county by having these agreements with specific organizations?
In terms of like other agencies that would be, or other...
I'm thinking of, does this at all disrupt the queue of people who are getting processed through any other normal way?
Yeah, that's a great question. That's specifically why in the resolution here, we've asked for 2 additional FTEs that will offset so that we can then hire and make sure that we're still providing the same level of service or even better service to the rest of the agency's residents.
Thank you so much.
No problem.
Thank you, Mr. Chair, and thank you, Commissioner Jebensig, for bringing this up. How many residents currently do Monarch serve in Ramsey County?
How many residents do they serve?
Mm-hmm.
That is a great question. I don't have that right in front of me, but they do serve, it is at least 400 to 500, but I would have to, I can certainly get back to you, Commissioner.
Okay. Yes, go ahead.
No, go ahead.
My question is for the evaluation phase, or how long is this contract for, and what is evaluation going to look like? And also what's success?
Sure. No, thank you for the question, Commissioner. This contract will be for 1 year. The evaluation will be along with Monarch to figure out how they're experiencing it as well, because if it's not helpful to them or if they don't like it for some reason, obviously they're not obligated to continue after the year. But looking at success would be that there's less turnover in their residents' medical assistance case, faster service for residents for their reimbursement rates. So there are a number of factors that we're taking into consideration in terms of evaluation.
Okay. And then the last one, if Monarch chooses to not renew, and or if the county chooses not to, what happens to the 2 FTEs?
If they don't renew, so at the end of the year, so those would certainly be absorbed into the rest of our complement in terms of the work, because the work is still there. And then I can get back to you. I don't have that right in front of me, but I believe they would be absorbed into our complement.
Okay, great. Thank you.
The question, it might not be appropriate to you, but similar contracts that we've had, I've had constituents really have a difficult time they sort of fall in between the cracks between the county's worker and the agency. And I guess what's the quality control here?
Yeah, so in terms of the contract, that is part of that's one of the things that we're looking to eliminate as part of that, because the agency then will have 2 eligibility specialists that they work directly with. So they will have their phone number, their direct email to say, hey, this person just entered our facility. We'd like to get them expedited because they're in, we just would for a number of reasons. So that's what that's looking to address in that pilot. I'm not sure if I answered your question. So
Yeah, you're on the right track. I don't recall exactly now I wouldn't mention it anyway because, it really isn't about blaming it. It's a systematic issue. It
Sure.
isn't a particular agency, but it's more frequent. I've had quite a few constituent calls over the year regarding this very issue, which just means we got to call the office and sort of say, what's going on, we need to move that piece.
Yeah.
Let me ask you this. So you say that's something that's going to be addressed. So lessons learned from this contract, how is that going to be applied to some of the other contracts where this issue it's getting to be prevalent in my views? But go ahead.
Thank you for that question, Board Chair. We do, part of that is understanding how the work is flowing in, and having those direct contacts with individual agencies will help us, will inform how we move forward in terms of, do we want to expand this and offer this more broadly, or is this not a great model that we think we need to actually scale back? I don't know I don't want to make any judgments in terms of what it's going to look like in the future, but I think that's exactly how we want to evaluate it, is using that to look at the process flow in terms of how that goes from that agency into us. But we work with a number of agencies across the county, across the county, in terms of what they send to us, what we send to them. And so this will give us a better insight into what you're asking.
Yeah. Okay, thank you. Hi, Sean.
I would say, I appreciate the flexibility and being nimble and trying to meet the moment with this pilot. I think it's very innovative and creative. I would also just continue to encourage the evaluation and making sure that, it's working both for the county and for the provider, but ultimately it's our residents who do not see gaps in services or coverage. And I also would like for us to consider how we work and partner with broader community groups and organizations. And particularly, I'm thinking about the assisted living home facilities where we have several people who have Medicaid or who rely on services there. I know that there are providers out there who provide assisted living facilities for many people who are on Medicaid or Medicare. Thank you.
Thank you very much. Appreciate it.
Thank you. I appreciate your time.
Did I get a second?
We don't have we need a motion.
No, I move that we move agenda item number 4.
Second.
Hearing no further discussion, roll call, please.
Miller,
Aye.
Moran is excused. Zong,
Aye.
Jebin Singh,
Aye.
McGuire,
Aye.
McMurtry,
Aye.
and Ortega.
Aye. Item number 5, grant agreement with the state of Minnesota.
Yep, that is me. I just wanted to quickly say, because this is in my district, and I want to thank the property management and library staff for continuing to reimagine our library spaces. And just also note that this grant, This grant is to expand public and community areas at the Maplewood Library, and is another example of how we're building inclusive spaces for learning, connection, and access to county services for all residents. So just wanted to uplift that great work and excited to see the new spaces. That, yep, I will move that item approved. Second.
Hearing no further discussion, roll call, please.
Miller,
Aye.
Moran is excused. Zhang,
Aye.
Jebin Singh,
Aye.
McGuire,
Aye.
McMurtry,
Aye.
and Ortega.
Aye. Item number 7, amendment to single source agreement with Youth Price.
Thank you, Mr. Chair. Hoping someone from corrections or someone from the team can come up and speak a little bit about this partnership and just share what some of the outcomes have been with the Youth Prize partnership, as well as ensuring that we are, meeting some of the goals around reducing out-of-home placements. Just wanted to give space to share a little bit more about that partnership.
Absolutely. Chair Ortega, Commissioners, County Manager Becker, I'm Elijah Norris Holiday. I'm the Planning Manager for the Office of Safety and Justice, and we're seeking this amendment so Office of Safety and Justice can expand the eligibility for the ISF funds and also the violence prevention grant dollars that are going to be distributed through Youth Prize. Currently, right now, through the contract with Community Corrections, the only eligible participants are young folks that are already on probation or part of the deep ends of our system. And as you know, part of our strategy in youth justice transformation is to have those investments become more upstream and more preventative. And so this is a quick approach for us to be able to quickly spend some of these grant dollars that were appropriated through the state. We have until June 30th, 2027 to spend those dollars. And so we're hoping to get this amendment passed so we can start spending those dollars to have more upstream investments. Some of the outcomes so far from Youth Prize from 2024, there's been over 200 youth and families that have been served and over about $150,000 that has been spent. Some of those dollars has been used towards rental assistance, helping young people with therapy, helping young people with school supplies, helping to cover funeral costs, helping young people get back into school, get their driver's license. Really, whatever the young person needs, they're able to come and request those dollars to the probation officers, and Youth Prize is able to facilitate that on our behalf. And we're just hoping to do the same thing for young folks before they become a part of the system in the deep end.
Thank you. I wanted to pull this mostly just for you to say all that. Because I think it speaks volume to the importance of this partnership and why it's important for us to extend and continue to do the amazing transformational work around youth justice that you and the team here are leading. So thanks again for giving that update.
Absolutely. Thank you, Commissioner.
Excuse me, hold on. Commissioner Singh?
Yeah, I just wanted to ask, is there somewhere where you have a list, or maybe you can describe the organizations, the broader community organizations that are working in the youth justice transformation and the Youth Prize work? I vaguely remember that there was a cohort or community of practice. Is that connected to this work?
So our plan is to connect the community practices to this work. The goal is to make sure that we are constantly tracking all the organizations that are serving our youth and families in Ramsey County, especially those that are just as involved. I don't have that list on me right now, but I can absolutely send it over to you, Commissioner. That's no problem at all.
It's broad, I believe.
Yep.
Yeah, just letting community know that just give an example of the kind of community groups that would be involved in this work.
Yeah, absolutely. So the JK Movement is one organization that comes to mind. 30,000 Feet is another organization that comes to mind. Korean organization in Minnesota, they've been consistently involved in the work that we do in YJT. To name a few, YMCA, Hired, there's another partner that we have. So yeah, I feel like there's a broad collective of organizations in Ramsey County that are coming together to provide the best support for youth and families.
It's great. It's great to see this work that's rooted in community. It's so important for that success to happen, to have it be co-created in community. I just have one question. So a number of us from the Youth Justice Transformation work had the opportunity to go as a learning cohort down to Montgomery and Selma. And one of the things that happens on these kinds of trips is the intense time that cross-sectional people from across the county get to be together working on thinking about one particular thing. And one of the goals that's stated in the RFP of the work that we're doing is to, in the developing wraparound services, is creating community-based respite options for conflict or crisis de-escalation. I know that this was a topic of which people from the courts, from our sheriff's office, from our social services and public health, and a number of us are really trying to brainstorm on how we can be expanding those services. And I'm just wondering if you have any thoughts on where we can go to continue pushing that work.
Yeah, absolutely. We also have a solicitation that we're working on currently. I can speak to that. Okay. We have a solicitation that we're working on currently right now that's going to provide respite shelter beds for young people engaged in domestic violence. And let me be specific. When I say domestic violence, I mean interfamiliar violence. So these are our siblings getting into a fight with other siblings getting into a fight with mom or dad or a step-parent that leads to young people being brought to the JDC facility. And I'm not excusing that behavior. It is serious behavior. But I think those matters can be handled outside of the system, and we can really dispatch resources to that youth and that family to resolve what the conflicts are, to keep that family from being further engaged into the system. So we're really looking forward to being able to post that solicitation for those respite shelter beds, and to also, in collection with that, be able to provide that family with additional wraparound support services to keep that family out of the system. This is part of our prevention work, our intervention work, to keep families further away from system involvement.
Thank you so much.
Yeah.
Commissioner McGuire.
Thank you, Mr. Chair. I'm so glad that my colleague pulled this and that we're talking about it, because it just gives me an opportunity to thank you, Manager Norris Holiday, for all of your great work that's recognized nationally, and we are just so grateful that you're doing this great work. So thank you so much for that.
Oh, it's a privilege to be able to serve the residents in the community where I grew up, and just thank you all for your continued support. Thank you.
Thank you.
Thank you, Mr. Chair. Yeah, I also want to just say thank you so much for being able to bring this to the board. I know that we have been talking about this for quite some time, and I believe it was your work in having some of those relationships at the Capitol too, where you have always advocated for our youth and the work that we're doing, and it was through those relationships, as well as through, a clear vision about how these funds would be utilized, that's why we're here today. So thank you so much for your tenacity, commitment, and ongoing support to our youth. Thank you.
And if I could say one more thing, Commissioner, I would be remiss to not to thank the wonderful team that we have in Community Corrections, Safety and Justice, all of our other partners in Workforce Solutions, the numerous community organizations that continue to show up on a quarterly basis, monthly basis, to engage in this important work to serve youth and families. So it's not just me. Thank you all for the appreciation and the gratitude that you extend to me, but I'm super grateful to have an amazing team just leading this work in collective with me. So thank you all.
Thank you for your good work. Okay.
All right, I can move item number 7.
Second.
Hearing no further discussion, roll call.
Miller,
Aye.
Moran is excused. Zhang,
Aye.
Jebin Singh,
Aye.
McGuire,
Aye.
McMurtry,
Aye.
and Ortega.
Aye. County Connections.
Yeah, good morning, Mr. Chair. I have a couple items today. First, I want to just let the board and public know that last night, CFO Kutza and I were able to present the 26-27 budget to the Charter Commission. I want to thank those members for their service to the county. They asked many thoughtful questions in our time with them last night. We were able to meet over at the Environmental Service Center. And that's one of the parts of our budget process that we're required to do. So that was a good meeting. This morning, I'd like to take a couple minutes to introduce to the board and the organization a couple of new leaders in our organization. The first person, and I'll have Michael start coming up here, is Michael Soto. Michael has been selected to serve as the Director of Policy and Administrative Services, and this used to be the Policy and Planning area in the County Manager's Office. He's going to be reporting to the Chief of Staff. Michael brings extensive experience in technical data analytics and leading multidisciplinary teams, joining us from Hennepin County, where he oversaw central analytics and data engineering teams. In this new role, Michael will be in charge of our research and evaluation for the county, as well as providing leadership around equity supporting our racial equity work and our health equity administrators, and doing a lot of work supporting our One Ramsey County approach when it comes to our strategic planning, our vision, mission, and goals execution. So welcome, Michael. Look forward to hearing from you.
Welcome, Michael. I met Michael at the correctional facility. So,
Is there a story behind that?
Excellent. Yes, that's it.
nice to see you in a different setting.
Yes.
Go ahead.
Excellent. Well, hello, Chair Ortega, County Board, and County Manager. I want to thank you for this time. I've been very grateful for the warm welcoming that I received across the county. People have been very excited for me to join the organization, and it's been contagious, and it's been great to think about what we might be able to do together. I'd like to thank Maria Sarabia for the trust and the support that she's provided, as well as Andrew Greenlee, who I warmly call my Ramsey twin, as we started on the same day. And especially, I'd also like to thank my team. So, as was mentioned, I'm leading 3 teams: policy, racial and health equity, and evaluation. There are 4 experiences that I'd like to highlight that I draw from as I step into this role. So the first is I've spent many years cultivating social networks within organizations. And so in this role, as I weave together policy, research, and evaluation, I'm going to focus on building internal cohesion within the team, building ties between the central team and the rest of the county, as well as into the community, so that we can most effectively serve residents. Second is research. So I have experience in both quantitative and qualitative research. As was mentioned, I come from Hennepin County, where I spent 3 years on a team called Integrated Data and Analytics, where we conducted enterprise-wide analyses of individual level data. I supervised teams of data analysts, data scientists, and data engineers. Prior to that, I also have a PhD in sociology, where I did qualitative research fieldwork in Colombia and Northern Ireland in post-conflict settings. And third, I've experienced leading initiatives both in nonprofits and international development. So I worked in benefit access and workforce development in New York City, as well as microfinance in Chile and Bangladesh. And lastly, I'd like to highlight, sort of on a personal note, as a son of Colombian immigrants, parents who spent decades washing dishes and cleaning toilets, I'm immensely grateful for their sacrifices, and I'm here before you today, very much in gratitude and thanks to them, and immense fortune to be able to be here. And so I draw from that inspiration and motivation to partake and participate in the work here in Ramsey County. So thank you very much for your time.
Thank you.
Welcome.
Welcome.
Thank you.
All right, thank you, Michael. Next, I'd like to introduce and welcome back Andrew Greenlee. Andrew is now going to be serving as the Deputy Chief of Staff. Andrew is no stranger to Ramsey County. He's previously worked in both social services and in our finance department. In the Deputy Chief of Staff role, he will support efforts to better coordinate, support, and lead across the County Manager's Office and within countywide strategic efforts that advance organizational priorities. Andrew did leave the county to join the Minnesota Department of Health, where he served as the Strategic Administrative Manager supporting the Health Improvement Bureau, which included 3 divisions, more than 380 staff, and a $360 million budget. So this morning, I've asked Andrew not only to introduce himself, but also to give the update on the federal shutdown. He's been instrumental over the last few weeks in helping to coordinate our response. And so, Andrew, if you can do those 2 things, that'd be wonderful.
Thank you.
Yeah.
Board Chair Ortega, Board of Commissioners, County Manager Becker, I am deeply honored to be the first Ramsey County Deputy Chief of Staff. Thank you so much to Maria Sarabia for giving me this very exciting opportunity, to Director Soto for jumping in alongside me, and to all the colleagues in the county manager's office and beyond for the warm welcome as I've gotten started. Little background about me, I'm a Ramsey County boy through and through, born on the east side of St. Paul, proud graduate of St. Paul Central High School. Yep, we're a proud group of alumni that band together. I had a sojourn away for grad school in the New York State, and mostly while I was there, while I enjoyed my graduate experience, I just wanted to get back to St. Paul. And that really affirmed my desire to live and serve in Ramsey County. I have a PhD in philosophy, and my research and teaching often focused on applied issues in public policy and health and human services. I also my work in philosophy really fueled my passion for advancing race equity. I worked with students to help them, equip them to be able to identify race-based disparities and inequities and think dynamically and creatively about how to address them. So after a while, after a few years of teaching as an adjunct philosophy professor, I decided to try to put the philosophical rubber to the road and, explore a career in public service. I started off in Ramsey County in the finance department doing procurement work. That was a crash course in operationalizing my lofty philosophical ideals in a complex bureaucratic setting. So a bit of a learning curve there, but some of my proudest professional achievements still come from my work in procurement, building strong community partnerships, supporting Ramsey County programs. So I also worked in the social services department, most closely with the Aging and Disability Services and MnChoice's management team, doing strategic planning, business optimization and quality improvement initiatives, leading other strategic initiatives, and a range of exciting work there. Most recently, I was at the Department of Health, like County Manager Becker mentioned, supporting the Assistant Commissioner of the Health Improvement Bureau, which the Assistant Commissioner oversaw a range of programs related to child and family health, injury prevention, substance use prevention, chronic disease epidemiology and prevention. And at the Department of Health, I was involved in planning and executing some organizational realignment initiatives, leading high-priority budget planning exercises, helping establish with the Bureau legislative priorities and advocate for them, along with a number of other strategic initiatives. I also was involved in an agency-wide effort to respond to the federal developments, both policy changes, funding cuts, and things like that. And that was a wild ride, and I hope to bring some of that experience to the county's frat team, where we're also doing very similar work. To summarize, I think my journey in the public sector has taught me that not only do I get really excited about lofty philosophical ideas, big ideas, I actually get equally excited about diving into the weeds on technical details to enhance operational efficiency and excellence. And so I want to bring those two things together to provide strong support, both strategic and tactical support, to our illustrious Chief of Staff, and to the County Manager's Office in general. So thank you so much to those of you at Ramsey County who have supported my journey, and I'm grateful to be here.
Thank you, Andrew. Do you want to provide the federal shutdown update now?
Yeah, so we've been tracking developments closely. We are now entering into the fourth week of the federal government shutdown. House remains in recess, and the Senate, after a 10th vote, did not pass the funding bill that would reopen the government. So we are continuing to work with state and federal partners to understand what programs might be impacted and how. One area that we're watching especially closely is the SNAP program. So last week we learned that the USDA, which provides funding for SNAP, notified the State Department of Children, Youth, and Families, DCYF, that funding for SNAP was running out. And so DCYF then issued some directives to counties about how the state was going to manage this issue. And ever since then, we've been working closely to track all the developments. We're meeting daily with a core group of Ramsey County leaders to coordinate and strategize our response. We're engaging with state and county partners through multiple channels. And what we know today is that DCYF will be sending a notification via email, text, and some alerts on their website that benefits will be, the recipients of SNAP benefits will be losing those benefits starting November 1st if the shutdown doesn't end. So that is going to be an alarming message, and we are working closely to align our messaging with the state and to get the word out and to think about how best to respond. So that notice is required. There's a requirement so that the state provide a 10-day notice of about changes to benefits, and DCYF has till 11:59 tonight to issue that notice, so we're not sure exactly when it's going to come out.
Excuse me.
Yep.
Can I ask just a quick question? So when you say that they will be losing benefits, I just want to make sure that it's very clear that they are not being disenrolled from the program. There's just no funding to disperse, correct? So when there is funding available, they will not need to go through the whole reapplication process?
That is my understanding. That I know our board chair, commissioners, County Manager Becker, that the FAS department is working to process as many renewals as possible before the end of the month deadline. And so after the end of the month, what we have been told by DCYF is there is going to be a block on approvals. So at that point, we won't be able to process we can process applications and renewals, but we can't approve them. And so exactly what that means for after the shutdown, how can we reissue benefits? I don't know all the details. We might have to bring up a FAS representative to speak to that. But we are doing as much as we can to process and approve as many new applications and renewals right now.
Thank you, Mr. Chair, if they're approved and processed, there's funding for them? I thought there was no funding available for the program.
There's no funding available, so the USDA is running out of funding for the program right now because of the shutdown.
Right.
And so they told DCYF that we cannot approve new benefits and issue new benefits starting in November. And so what Ramsey County can do is accept applications and process applications, so we can still do some of the administrative work, but we can't, starting November 1st, what we know as of today is that we cannot approve the applications and the renewals starting November 1st, and we cannot issue November benefits.
So just another clarification. So you can't issue benefits on the new ones, and are we not issuing benefits on any of them, or are we still able to issue benefits on the existing? We aren't able to issue benefits on anything. Right?
Starting November 1, what we heard is nobody is receiving their November benefits.
Right, that's what
new and existing.
That's the unfortunate reality that we understand. That's
yes.
Well, and then the other issue is how much of the administrative costs is tied to the SNAP, let's say.
How much?
Well, we get reimbursed for administration, don't we?
Yes.
So that has an impact on our payroll. So that's another issue we'll discuss, but I mean, this has tails. I have Miller and then McGuire.
So do we have an update then on the MFIT program and the cash assistance as well?
Yep, Board Chair, Board of Commissioners, County Manager Becker. We were originally notified that both SNAP benefits and MFIT cash and food benefits could be impacted. The state has then subsequently been trying to ensure that the MFIT cash benefit is not impacted. That is still a work in progress. So we know that the USDA funding, what we know now is it will impact the SNAP food benefit and the MFIP food benefit. The MFIP cash benefit, we hope, will not be impacted. We're still waiting for final word on that.
Okay.
Mr. Chair, it's an evolving situation, and so rather than give inaccurate information, we want to continue to use today because today's kind of the day of some of this determination. So we'll make sure the board and working with our communications team be able to share this out both internally and externally so everyone has the exact information. Like I said, like Andrew mentioned, DCYF has till midnight to continue to work on this too, so we don't want to get too far ahead of ourselves. In terms of your question about the administrative costs, it's something we're very aware of. I've had the CFO do analysis. We will keep the board up to date as to what those impacts are.
And on that note, thank you, County Manager Becker. Thank you, Mr. Chair. Just because a number of us are hearing from our legislators, from the people that represent all of our residents, we're all very alarmed by this, and so they're looking for information. I appreciate the information that's coming out so far, and we'll just continue. Thank you for letting us know, and we'll continue to get out communications to our other elected officials who are also wondering how this is all going to manifest itself in reality in the county level, because it's of course coming down from the federal to the state to us. So thank you for that. We'll just stay posted on that then. Thank you.
Commissioner Singh?
Yes, I just want to say that having been in community with some of our emergency food shelves and other food security providers, our nonprofit partners within Ramsey County in serving our residents, and I could be getting the letters wrong, but I believe there's been some cuts in TANF and other kind of sources that are
TFAB.
The TFAB, sorry, that are actually cutting dollars to the food supplies to our food shelves as well. So I'll just say this, that it's coming from all ends, that the food security supports that are government funded and those that are government administered and nonprofit funded or nonprofit administered are getting squeezed in both ends. And so this is a time of not only uncertainty as these policies are being handed out and decisions on how the state is deciding how to handle this, and then we as the counties who have to operationalize these programs are in real time, hour by hour, figuring out what that means for us, that our nonprofit partners and community are in a similar disarray. And not by their own fault. They are waiting anxiously to be as organized and mindful and thoughtful and continuing to serve residents. And we continue to have those conversations across our partners as well. I appreciate that you brought that up. And so it's with frustration that we ask for grace and patience, because that's what we have to give to our partners as well, as we anxiously await direction on what steps we should take. But if there are community members out there who are wondering, I mean, if there's any way to continue to support your community organizations that are supporting individuals who are food insecure, now's the time.
We are, our system is interdependent. And so even when we hear talk about our community partners and nonprofit, let's not make the assumption that they're healthy and they're gonna, we're all facing the same pain. And it's just going to be painful. We knew this was coming from the beginning of the year, and now it's hitting us. So thank you for keeping us informed, and let us know as soon as you know what's going on. This is going to be tough. I've been talking with nonprofits, and they look at us, and I'm trying to tell them, the same message. We're in this together. There is no clear answer to how we deal with this until we come up against exactly what are the barriers we got to cross. Thank you.
Thank you.
You done? Okay, let's do, we have a super full day today. We're going to straight through to 5, no lunch and everything else is meetings. So with outside board and committee reports, could we keep it, just make it a short story?
Trying to say we got some talkers here.
I'm gonna, right, Sean?
Thank you, Mr. Chair. I'll keep it brief. I had the honor and privilege to attend the Burns Institute trip to Montgomery and Selma now 2 weeks ago, came back and got sick. So that's why I was unable to attend last week's board meeting. I just wanted to say that, this trip was really, just sobering of how far we've come, but about so much work that still needs to be done, and about the resilience in our community, especially African American descendants of slaves. I wrote some notes that I just want to share from touring the facilities or the museum, and about the work that we still have so much to do and our responsibility to do so. As we were walking through, just also seeing children and families being ripped apart intentionally, and about so much despair. Where we are at today is, we are not there, but we are seeing that happen across our communities right now, where family members are being torn apart by ICE. So I left there with, this pain, but also more so about a resolve that, a quote that I found over there at the museum where it says, "We stand on the shoulders of many who did so much more with so much less. We resolve to honor their legacy and continue the struggle." So this is something that will help guide and just grounds me in the work of what we are doing and what we are doing every day. Just as we have passed, the single source agreement with Youth Prize as one of our work of trying to work upstream, as well as a board item today of the African American Preservation Family Act of working harder to keep families together and not ripping them apart. So I had to provide that quick reflection, but also that, this is a reflection that's going to be ongoing and every day in our work. Next, I want to point to 2 events that are happening in my district. This weekend is one of the district council's community event. This is Halloween focused, but also they reached out to us as a county because they know and feel that there are concerns in the community about food security. They specifically asked about what are food security resources that we have out there and provided out in the community. So the conversation that we are having today about SNAP and about families going without it, those concerns and fears are very real, and there's so much work that's happening all across the state and also the nation in response to this. The other community event that I want to mention before I talk about some of the work around SNAP that I've been leading on is there's lead testing and community resource fair. That is happening tomorrow at Battle Creek Rec Center. Thank you to our public health team and environmental health team for being proactive and focusing on this, since the east side also has higher levels of have more kids who have lead in their blood. So this is a proactive lead testing that is being offered at Battle Creek Rec Center. And finally, my comments about SNAP is that it's very real. I can just remember when my family depended on SNAP, and to go out or to not receive benefits when you're expecting puts a lot of pressure. And I remember a letter that my dad wrote to the county worker and says, "Help, we have no money, we have no food." That is the pain that many families will go through come November 1st. And for the until the federal government acts. And then the counties, we are scrambling. And so County Manager Becker, thank you so much for your team and your leadership in this and trying to cipher through so much information that's coming in the uncertainty. I have been on calls with NACO's subcommittee, so they're not calling it an official committee, but it's a working group off of the Health and Human Services committee that I'm on. And states across the country, there are only about 13 states that administer SNAP. And so everyone is having questions about what to do, that they may have to shift some of the costs to their property taxes to respond because the federal government is forcing the states to bear in some of the costs of administering the program. In Minnesota here, very specifically, those are conversations that we are having at AMC, at our association with the department about how those cost shifts are done. And, you know, just reading through what error rates are or what determines error rates is such an ineffective use of our time and use of taxpayer time in a program that serves hungry people. And it is very ridiculous about what counts as an error rate. I can share more in detail later, but you know, just if there's a missing document or if something gets typed in short, you know, it counts as an error rate against the county, right? And so there are so many of those conversations about how to reduce it, but ultimately the action from the federal government is to make it hard for people to live. Mm-hmm. So, Mr. Chair, I'll leave it I'll leave it there. And I was not a great example of keeping it brief, but I did miss 2 meetings, so I yield back my time. Thank you.
You usually listen to me, so I'll let it go. But it's when you talk about your father, I remember in New York City, my mother writing a letter. I was like 6 years old. She kept writing letters to the mayor of New York because we needed housing. We were all in basically a 1-bedroom and no bathroom. And I think about that now and I'm saying, you know, it kept hope alive, but that wasn't going nowhere. And so it's those stories are powerful and important to keep remembering as we do our work. Commissioner McGuire.
Thank you, Mr. Chair. I appreciate so much Commissioner Zhang's report on the things that she's working on, and thank you so much for all the work that you are doing with AMC and NACO and about what's going on at the federal government, shifting all of their expenses, shifting all of that to us to manage and onto our taxpayers. So thank you for all of that. I will be brief, Mr. Chair. I just want to give kudos to our legislators who are out in the community doing town hall meetings. Peter Fisher, Representative Fisher gave a town hall at Little Canada. Senator John Marty did a talk on healthcare, on the current healthcare situation in our community. The Roseville Business Council's meeting tomorrow with their economic development team is providing an update. That's in Roseville City Hall at 8 a.m. And tomorrow we have a Recycling and Energy Board meeting where we'll continue to talk about the work that we're doing in that area. And then just to say that next week, many of us will be at a conference focusing on the Advancing Equitable, Sustainable Communities Through Innovative Transportation and Mobility Solutions, called IMPACT. Brings together leaders in transit, land use, housing, and community development to share strategies and spark collaboration. We're excited about that. So thank you, Mr. Chair.
Okay. I will also thank you. I will also keep this brief, and so if I just list meetings and don't go into details, it's just because of brevity and time. One, I just want to thank AFSCME leaders and some of our detox center workers for sitting down with a handful of our commissioners to be able to hear directly from them their thoughts and concerns and ideas about transition. It's important for us to have those conversations, and I do appreciate them having that time to share with us. I want to say that Commissioner Zhang and I also had a chance to attend our monthly CAPRW meeting, and just say, to get into the nitty-gritties with any of our nonprofit partners who are providing direct services, whether it's through our energy assistance or nutrition programs or through Head Start. These are really trying times, and there's a lot of I think it's been said before already, wasted energy just spinning as things are in churn versus concentrating on serving our communities. So it's tough times all the way around. I really appreciate County Manager Becker and Commissioner Miller and myself got to go back to kind of my old stomping grounds with the Venice Heights Economic Development Corporation and Partners for Good. We had about 20 to 25 local nonprofit leaders at a lunch and learn, learning about the county, how to do work with the county, how to partner with the county, but also that is a space where I have sat around and was sitting with those leaders during COVID when, again, life was really precarious and uncertain. And there are many tables like that where community leaders are sitting around, working together, collaborating, listening to community, being nimble and responding to really difficult times. It's an honor to have the county be invited into those spaces, and we encourage those kinds of tables and those community partners who have that muscle already, that connective tissue within pockets of the county, to be able to invite us and to keep us as a county partner in those conversations so we can all lean on each other to fill the gaps, to avoid duplication, and to focus on serving our communities. So thank you for Partners for Good for allowing us that time. I appreciate yesterday I had a visit from my colleagues at NAMI Ramsey County. They are lifting up the importance of supportive housing and the need to be able to assess how much supportive housing we have for those living with severe and persistent mental illness within Ramsey County. And they have a lot of different ideas of keeping that issue and topic alive. So that just warmed my heart to know, again, we have a lot of people working on issues that are important to us here at the county. I was able to go to the Mounds View annual town hall. The city of Mounds View is just, their motto is welcome home. And they regularly have their notary at any of their community events so that people can continue to release the covenants on their deeds. I saw a handful of them just in the 5 minutes as we were walking into this meeting. That legacy of hurt dismissed with a stamp and a signature, because the city has made it that easy to move the ratification of those harmful policies forward. So thank you, Mounds View. I will say I also will be attending the Impact Conference, and it's in Portland. And with the court orders going on that are allowing the National Guard to come into that city, it's with some trepidation. And there is that question in your heart of, is this the right time to go there? And I do think it's important for us to bear witness to what's happening in our country. So we will be watching and we'll report back what we see. And lastly, just because I do think we need to have a little bit of good cheer, happy Diwali to everybody who is celebrating. Diwali was celebrated yesterday, and it is the celebration of victory of light over darkness, hope over despair, and I think that is the kind of message that we can all draw strength from in these times. So happy Diwali, everybody.
Thank you. Commissioner Moultrie.
Thank you, Mr. Chair. I want to just highlight a couple of forward-thinking projects and work that's happening along two important corridors in my district. First, along Payne Avenue, I had a chance last week to tour what will be the new Latino Economic Development Center with Executive Director Alma Flores. This space is going to be tremendous and will, I think, add to the revitalization of Payne Avenue. Within their space, they're going to be relocating their headquarters to this location, but also this will be an event space for the community. It's going to be an incubator for small businesses, specifically with the food hall that they're going to have in this space. Really excited about the work that LEDC is continuing to do to support small businesses, not only in Ramsey County, but throughout the state of Minnesota. And so just excited about their project to come for next year. And then secondly, I just want to thank everyone who came out to the Reopen Rice Street Phase 1 on this past Saturday. We had a chance to celebrate the end of construction for Phase 1 from Wheelock Parkway to Maryland Avenue of this three-phase reconstruction of Rice Street. With this reconstruction, it's moving from a 4 to 3 lane conversion. It's going to have shorter pedestrian crossings, updated stormwater systems, a lot of important things that we need along that corridor. And I think this also is a great example of what's to come for Rice Street and ensuring that we're expanding and growing our economic tax base, especially within this community on the north end. And I just want to say a special thank you to all of the residents and the businesses, specifically in this first phase stretch, for their continued patience and understanding and collaboration with Ramsey County Public Works to get this project done, as well as partners from the North End Community Council to the Rice-Larpenteur Alliance for their continued collaboration with us as well. And then the last thing I'll end with is as we continue to gather input from constituents in regards to the budget, tomorrow from 4 to 5 p.m. I'll be hosting virtual office hours to talk through the budget and to answer questions from constituents. Thank you.
Thank you.
Okay, you ready for my long one? So last Thursday I traveled to Duluth to meet with tribal leaders and the AMC staff. While Ramsey County does not have any tribal nations or communities within our boundaries, we are home to a large-ish and growing American Indian community. So the meeting I felt was productive and included meaningful dialogue around our shared priorities. Both AMC and the tribal leaders emphasized legislative goals that they really do align closely with what county goals or priorities are. We also discussed adapting the tribal-state relations training that is currently designed for Minnesota state of employees into a version that is tailored for county government. So more to come on that, and we're excited to hear that. And then quickly, I started office hours. I hosted office hours last week in White Bear Lake, and I have 2 more coming up this week on Thursday in North St. Paul at the library from 1:30 to 3 p.m. and then at the Maplewood Library on the same day, Thursday, from 3:30 to 5 p.m. So invite residents and constituents to come out and chat with me. I did have one guy from 64, so from St. Paul, come and meet me to talk about early voting in White Bear Lake. It was pretty surprising, but hey, that's what I'm there for. So with that, I'm done. Miu, thank you.
Great, thank you. I have quickly 2 things. First of all, Commissioner Singh, Miller, myself, and the County Manager, Ling Becker, attended the Clues Annual Gala. We had a good time. We had a Ramsey County table. The organization raised several $100,000, all of it going to the food bank. So it was very successful. The previous week I had reported on Neighborhood House and how they raised almost $500,000. You know, it's going to take, the message to this is that it's going to take individuals that have wealth to come and help, bridge the gap here, because government is paralyzed. I don't know what to say, but it was surprising to me in many respects that people keep giving, and that's so critical. That's how we're going to make it through this. The other is I met with Officer Barton, a Deputy Sheriff Barton, and he does the community outreach for the sheriff. And he just wanted to update me on his work and what he's doing, and I just want to applaud. I think we keep talking about prevention, and I think this is one of the ways in which we keep connected with community, especially in law enforcement, because it's always a negative connection with law enforcement, right? And so there has to be, we need community to support our law enforcement to make our neighborhoods safe. We have a busy day. Right after I adjourn this meeting, we'll do the regional rail very quickly. We have then at 10:30 a board workshop that will be led by Commissioner McGuire. At 12 o'clock, we have a lunch and learn with the Building Owners and Managers Association. Those are all the owners of the buildings in St. Paul. At 2 p.m., we have a board workshop, all hands on deck, and Commissioner Shang is going to lead that, and that has to do with our continuum of care and so forth. Then we have a closed meeting at 3:30. Oh, we also have a tour of the Downtown Service Center. Then we have a 3:30 closed meeting regarding labor negotiations. I think that covers the day. That's enough. We are adjourned.